Thank you so much for being on the show. I'm so happy for everyone to get to know you because you've become one of the amazing people in my kind of team as I embark on this new stage in my life of trying to get my PhD. And you've helped me in so many ways that I really just wanted to share what you do on the show. So, why don't we get started with you explaining what you do for a living?
Sure. I am a chiropractor, but I do a specialized technique that's called upper cervical. So I always point to my neck too. I literally just had a phone call the other day and I do it subconsciously, upper cervical. But if I'm on the phone, they don't see it. And very frequently it's confused with something else. And they're like, oh, so you like work with women. Like,
Oh,
well, I
okay.
also work with women, but you're thinking of something different. Cervical
Yeah.
is top bones in your neck and top two specifically because it's more of a neurologically focused technique.
Hmm.
So we'll get into it a little bit more obviously on this, I'm sure, but your nervous system is what controls and coordinates everything in the entire body. And it is housed in the spine. So the spine protects it. And you have what's called your brain stem, which is the part of the brain that controls all of the things that are called your autonomic system. So all the automatic things you don't think about, like your heart rate, your breathing, rest, digest system, sympathetic, parasympathetic. Let me know if I'm like going too much off the deep
No,
end with them.
go for it because that's what I want everyone to hear. Because when I explain it, I don't do a good job.
Okay.
So you
Well,
go for it.
thanks. It is basically your master control system, your nerves. So if they're not functioning at 100%, your body's not functioning well because it's what sends signals to the brain, and the brain is what tells your body what to do. So if I describe the nervous system like your information highway, if your nerves aren't functioning well, you're going to see dysfunction throughout the body, and it could show up in a myriad of different ways, but frequently it'll be migraines, headaches, chronic pain, and I see a lot of people with migraines. Obviously, we'll get into that too, but upper cervical, like I said, neurologically focused, is a different technique within chiropractic. There's only 1,200 doctors in the world that utilize it, that do it, because it's more postgraduate work on top of grad school.
Hmm. Now, for people who don't know exactly where the cervical vertebrae is or how important it is, I once had an osteology professor explain it to me. I'm going to mess it up, but it was like lunch or breakfast, lunch, and dinner, with the cervical being, I think there's 7 cervical vertebrae,
Yep.
and then I don't want to mess it up, but
You're
for
right, 12.
okay, 12.
Mm-hmm.
And then is it 5 lumbar?
Correct.
5? Okay. So I just want to, for anyone who's not familiar with it, because before seeing you, had I not heard that in osteology, I wouldn't have known what you were talking about when you said cervical
Upper cervical.
vertebrae and how important the C1 and C2 are, how that's right underneath your skull, the first ones, right?
Yeah, exactly. It's every nerve in your entire body besides your cranial nerves. I'm sorry, the Miramar base is right next to me. So if you hear the Blue Angels are training right now, I think, and they're going off right now.
Okay. No worries.
The upper cervical, those top two bones, every nerve besides your cranial nerves, which are the ones that go like your eyes, your nose, your mouth, go through those top two bones before they go to the rest of the body. Even the ones that go back up to your head where you feel like migraines that happen, those go through those top two and then come back up. So if there's an issue right here, and I can explain it now or go into it later too, you can see changes throughout the rest of the body. I like to use a lot of analogies and examples because it makes it easier to relate. Like you said, no one's really heard of like the cervical
Yeah.
spine portion. But a lot of people have heard of Christopher Reeves. He
Mm-hmm.
was the guy who played Superman, and he was in a horse accident
Yeah.
and was completely paralyzed. His whole body stopped working, but he only broke one bone. So
And
that one bone caused massive whole body issues. I'm sure you know where the bone is or can guess.
is it the C1?
Yeah, his C1
Okay.
right there. So that top bone, this bone way up here made his foot not be able to move, made him not be able to move his entire body, not just his foot, but this up here affected all of that. He ended up dying from a staph infection, which is a super simple immune response because, again, your immune system is also controlled by your nerves. Everything in the body is controlled and coordinated by the nerves.
Wow. So before we get too much into that, because I'm already questions are already popping up into my head. Wanted to ask you, how exactly did you fall into this line of work? Because it is so specialized. Like, what was there a particular experience? Did you deal with migraines as well? Like, how did you find this, and what made you decide to devote your career towards it?
Great question. Kind of a two-part answer.
Okay.
I initially found the chiropractic in general line of work because of my sister. She's 14 years younger than me. And when she was 2 years old, she woke up one morning not able to walk after like starting walking at 9 months. So she'd already been walking for over half her life at this point. And she woke up like in pain, kind of crying. Her leg was a little bit slightly blue and they didn't know what was going on. So they took her to the doctors. They did a bunch of tests. They ended up just putting her on antibiotics because they're like, maybe it's, an infection. And they still didn't have an idea. And it was almost a whole week of this, my sister being in pain, not being able to walk. And my mom was really obviously anxious and willing to try anything. Her best friend said, hey, you should take her to my chiropractor. And we'd never been to a chiropractor ourselves or even thought about it for a child. We're like, what? No, not for a kid. And my mom was desperate. So she's like, sure, I'll try anything. So I was in the room and I saw the woman do the full examination and I saw her adjust my sister, and my sister got up and walked after not walking for 7 days about. And it was like, I was 16 at the time. So I was highly impacted and thought like, that's incredible. What is that? Yeah. And I wanted to learn more about it. And I was shadowing other doctors in the local area. And there was somebody who was a retired Air Force. I think majority of the people get into the profession because of a change to their life or someone they know. He had been a parajumper and was injured, wasn't able to actually perform any of his work line of duty anymore, and was able to get back to full functioning health again via chiropractic. So he ended up, might have been medically discharged, but he ended up switching and going back to school and becoming a chiropractor himself. And I was shadowing him and seeing, it sounds ludicrous, but seeing like people bent over walking in and then walking out upright after being in so much pain with just like that one adjustment. Wow. And the main thing that really got me was him telling a story about a woman he had met who was just so in pain, chronic pain with her lower back. She was on opioids and just taking painkillers and got addicted, wasn't able to be the mom to her family that she had been before the addiction. And they just found her in the kitchen, knocked out, and her kids found her. And she was like, at that point, that's when she realized like, I have a problem. I need to find something else. Yeah. And she started seeing him and was able to get out of that chronic pain cycle and was able to get off of those drugs and become a better mom again to her family, which was like really hit me.
Yeah.
And I had a huge aha moment. I remember exactly where I was standing and I felt like this is my vocation. This is what God's calling me to do.
That's really cool. That's amazing.
Yeah.
No, really, that's that clarity. I feel like not everyone finds that. So that's amazing. That really is.
Yeah. So that was the first part. That was a long answer. First part of why I thought this is what I want to do, chiropractic. But then the second part of why upper cervical was I was in school and I was learning these different techniques, and I loved the message that chiropractic shared, which was your body's incredible and it has the ability to heal itself if you give it the choice. But it didn't feel like it was completely congruent with the, you need to see me for the rest of your life for that to happen. That was the part that I just like couldn't really comprehend how they connected. And with upper cervical, the intention is it's so specific and it's helping take care of like the main area that needs the adjustment, that needs that correction, that we should be able to retrain your body to hold and stabilize. Unless you have some big trauma that happens again, we should be able to get your body to the point where you don't need to come in weekly to get adjusted. Like we can go and check you kind of like a dentist every 3 to 5 months, just check and make sure you're holding by the end of the time.
Yeah. And you kind of hit on something there, which is why I think there's a lot of stigma surrounding chiropractic work, which is you need to continue to see me forever and ever. And before I saw you, I saw a general chiropractor a few years before seeing you. And I got the same impression, and that didn't really sit right with me. And you still to this day are the only medical professional who ever told me I don't want you in a funny way, like, I don't want you to be coming here forever, like
Yeah.
in a kind way, but you had the intention of, I want to help you to get rid of this so that way you can live your life. And that was, I've never had anyone I've been to hundreds of doctors and none of them ever told me that. So what are some of the other stigmas surrounding your work, or you think things that are preventing people from really receiving true chiropractic help?
I think also living in California is a little bit more progressive. So I was going to say, I think hopefully some of those stigmas are decreasing. But I do think that there's a positive trend towards, in America in general, of realizing that it shouldn't just be tertiary care, meaning you should only go to the doctor when you're like super sick and you really need help fixing it. Like when it's broken, then go fix it. Mm-hmm. And I think there's more of a preventative measure focus, and there's more of a trying to maintain what I call, well, not I call, but it's called salutogenesis. So mm-hmm. It's the idea of like a health module instead of a sickness module, in terms of how we're looking at the world and trying to engage people to becoming more of a preventative measure, staying healthy. How can you be at optimal thrive levels mm-hmm. versus waiting until you're sick, fixing what's broken, and kind of just maintaining this position, if that makes sense. Yeah. So I think some of the stigmas that are still there a little bit is it's an alternative medicine. It's not mainstream. Obviously, I get very frequently, you're not a real doctor. I know. And a lot of times it's just like limiting beliefs that people have kind of been inundated with. They grew up with that around them. So they just assume it as well. Like, well, I don't believe in chiropractic. Mm-hmm. And it's not a religion. It's not a faith. You don't have to believe in it for it to work. It's going to work regardless.
Yeah.
The intention is, again, your body healing itself. So it's not you need to see me or you need to put a medicine in your body or take something out. It's your body was created beautifully and perfect the way it should have been. We're just helping correct some traumas that could have happened previously that is causing what you're experiencing now. And we'll probably get into traumas and stressors in a moment too, but
yeah.
Yeah.
Well, you hit on a few other good things as well. I liked how you said that you had this belief that the body is supposed to, that it can take care of itself. And I feel like that kind of goes against almost everything in our medical system right now in Western medicine, but we'll get into big pharma later probably as well. But before I get into all of that, I have another question that may seem simple, or maybe not. And I want to hear your answer. What is a migraine? Because I know my answer, but I'm like, what is the medical answer?
Definition of it. A lot of times, diagnoses and names of things are based off of symptoms. So it's not like an actual physiological thing that they can narrow down, because there's like 3 or 4 different theories on what causes a migraine. But mm-hmm. migraine in and of itself is like a level or amount of symptoms. And if you check all those boxes, then yep, that's defined as a migraine. And obviously there's so many different types of migraines and headache names that they have. Yeah. But frequently a lot of things are, these are the symptoms you're experiencing. This is the diagnosis that you're getting with it. So when people are experiencing migraines, typically they'll say, okay, do you have light sensitivity? Do you have sound sensitivity? And what that is you have your body's ability to integrate external stimuli. So external stimuli meaning other things around your body that your senses are able to tell your brain what you're experiencing. And when you have that hypersensitivity, then that light and the sound is going to be affecting you worse. So typically when you have a migraine, your head hurts, and it could be one-sided, it could be both sides. You frequently will have like an aura. Some people will be nauseous because that's involving your brainstem, the nauseous center right there. That sound sensitivity, light sensitivity. Some people have like floaters. It's kind of different for every person. I've had patients that have a hemiplegic kind of a feel with it, like half their body will go numb, or or stroke-like symptoms where they actually can't move their body well when they're also experiencing a migraine. So there's a lot of different things, but there's different theories around what causes it. Some of it is vasculature. They say there's something going on with your circle of Willis, which is like the blood flow to the brain area. They say lessening of that. There's some people that say it's a neurological, which obviously it is because your nerves are what control and coordinate everything. But some people say that it is, typically vasculature or neurological, but your vascular system is controlled by the nerves. So
I loved your answer. It was so much more eloquent than mine. So I started, I don't even know if I mentioned this in the interview yet. I said that I'm seeing you and that I've been receiving treatment from you, but I don't know if anyone who watches the show or listens to it really knows that I've dealt with chronic migraines for over a decade, which was the main reason I even came to see you. And my way of defining it was it's always felt like my nervous system was hyperactive or like it was short circuiting. And that's why all of these different things were happening. And I would always get frustrated whenever I would go to my normal doctor and they would say, we just got to find the trigger. We got to find the trigger and we have to reduce your stress. What do you say to that? Because I personally got so frustrated with that. So what would you say to people who are dealing with migraines who are probably also frustrated by hearing that same thing? Is that even something we can do to find, is there one trigger? I'm guessing not really by what you just said.
I'd say, I mean, to your point, you do have people who will say, oh, I know my triggers. It's like wine or chocolate or loud noises, and it causes that change. And the other approach that you just mentioned of them saying, okay, well, we need to find your triggers and then just avoid them. That's not really realistic unless it's like a food of like wine. Okay, stop drinking wine. That's a bummer, you know, but you can do it. That's a thing. But I would say that that's kind of more of a Band-Aid approach of trying to like fix the wrong problem. Like, no, we don't want to address like just avoiding triggers. That's not the actual issue. Like, why is that a trigger? Why does your body respond to that thing that way and cause you to experience this migraine? Like, let's fix the root problem, not just kind of cover up the symptoms or avoid what can cause those symptoms, you know? And a lot of times you mentioned it, stressors. Yes, everybody's experiencing stress in their life. You can't just avoid stress. But there is such thing as eustress. So eustress is called like good stress. That's, you know, like putting stress on your muscles and your muscles growing. But distress is like when your body responds to something negatively. And a lot of people just use the word stress to cover all distress. Like, I'm stressed at work, I'm stressed at school. Well, you're allowing your body to react to that thing. Like, school in of itself is not a stress. Like, it's not, it's an inanimate object. It's not a real thing. That's like, it's not a tiger coming at you. It's your body perceiving it to be stressful. So there's a lot of people who like practice meditation and mindfulness, and like what would stress them out is a lot higher of a level of someone who doesn't have all of that going on. And so like tiny little things stress them out. And what happens is, I use this analogy a lot too. Your nervous system is, again, what integrates that external stimuli. So all of your surrounding things, your senses are via the nerves, telling your brain what's going on with your external world, which causes how your internal world reacts and changes. So if you think of your nervous system like a cup, and your nerves are functioning at 100% optimally, it's like having a giant big gulp cup, and stress is water. You're pouring stress in. If you have a really good nervous system functioning at 100%, you can put a lot of stress in before you feel any changes, any symptoms, any triggers. Versus if your nerves are not functioning at 100%, it's like a little shot glass. Any amount of stress can cause that symptom change overflow really quick. So people who have a lot of triggers, they probably don't have a very, very high functioning nervous system. And so any amount of stress, that trigger happens.
Yeah. No, I thank you for explaining that, because I think that will actually help a lot of people who are in the midst of dealing with their migraines. And I remember I reached a point where I just felt so overwhelmed and honestly hopeless, because it was constant, having multiple doctors telling me there is nothing we can do. There is no cure for migraines because we don't completely understand them. So the best thing to do is reduce your stress, find your triggers. But I always wanted to be like, I'm a teacher. I was in grad school at the time. I was like, I can't remove the stress. I can't just make all of that go away. And I always felt like it was just, let's deal with the symptoms, never let's find the root cause. And that was one of my favorite things about meeting you, was you actually took the time to explain to me what was going on with my nervous system. And then in the first few appointments, it's all specialized to what that person is dealing with in particular, what's going on with your cervical vertebrae, your history, the medications you've been on. And I never, ever had that type of time or care around it. And it meant the world. And I know other people who are dealing with migraines know exactly what I'm talking about, when you feel like you just become a number and you just get tons and tons of different, I call them like prescription cocktails thrown at you, where we believe that this helps migraines. So let's put you on it and see what happens. And then you get to the point where you have 3 different medications that you really don't need. And then you have all of that on top of dealing with the migraines that are still there. So, yeah, I've never liked that narrative that they throw at us. But something that stood out to me in those first initial appointments as well is how you described trauma and how the brain perceives trauma, because I had never heard of it that way. And I don't want to mess it up, but I believe you said that to the brain, trauma is trauma. And it doesn't necessarily matter if it was caused emotionally or physically, but the reaction and or the effect it has on your body is similar or identical. I don't want to mess it up, but I'll let you take the wheel on that one.
No, that was really well done. No, that was right on point with it. You're right. You can have, it's not just physical trauma you can experience. Your body is not just a physical thing. You have all aspects of your health, your emotional, spiritual, social, physical, actual physical, right? And you need to address all of the components because they all play a factor into how your body is. So it's more of a holistic approach. You can't just compartmentalize things and say, okay, today we're only going to work on this thing, and that's going to fix this one thing. That's not how it works, right? If you have a change somewhere in the body, it could cause compensatory changes elsewhere too, and not just the physical. So you were right with the way that your body is, again, integrating that external stimuli, traumas. What is traumatic to some person could be like nothing to someone else because of the way that your brain integrates things, perception. A really good example for like understanding it's not just the physical way that affects your internal body. If you were like driving and you heard the cop lights come on right behind you, well, your dad's a policeman, so you might not experience this, but I freak out every time. I'm like, oh my gosh, what did I do wrong? Yeah. You have like your heart rate increase. You probably start sweating a little bit. You have that sympathetic response of like, shoot, I'm in trouble.
Yeah.
Even if they fly past you. And it's not like, it's not like you're actually physiologically in physical trauma. It's not a tiger coming to get you and you need to run. It's your body's response. Same thing like if you had a pop quiz you didn't study for, your heart rate increases. Again, you have that sympathetic response. So your body's autonomic system is giving you a response internally based off of how you're perceiving your external situation.
That's amazing. I mean, that just was so, I had never had anyone explain that to me. And it kind of, I think it connects to everything you mentioned about the nervous system, because even when we looked at my x-rays, I was shocked when you told me my cervical vertebrae was not only basically in a straight line, but almost going the exact opposite way that it was supposed to be going. And then, like, as if that wasn't scary enough, you said that basically it's kind of connecting to all of that, and that for almost or over 10 years, my body was kind of in a constant state of that flight or fight response. And I'm like, that explains so much of why the hyperactive nervous system and why it was so hard to try to figure out exactly what's causing it, because it's all, I don't know, it's hard to decipher. But what can you say about that kind of that constant why does it feel like that constant state of stress?
Yeah, that's a great question. That state of that sympathetic response you're just talking about, being in that fight or flight or freeze is what it's sometimes called, state, is something that is healthy and natural in very small, short doses. But society has changed our perception and our external stimuli and situations to be constantly in that state, which is not what it was designed for. So what happens internally is you see neurochemical responses and changes. So you'll see that cortisol increase when you're in that state. And it's supposed to be good for a short little burst to get you to safety, where you should be able to drop into that parasympathetic rest and digest state. And that's when your body's healing. But if you're stuck, which majority of society, I would say, is in this hyper sympathetic state, where you're constantly increasing your cortisol level, you're going to see changes within the rest of the hormones in the body, as well as behavior and perception. So many people are anxious nowadays or depressed, and it's not just a lot of times people say, well, it's genetic. My mom is also. It's not just that. Frequently, it's more of an epigenetic issue of they've been surrounded in that environment. So they have an epigenetics, meaning your environment plays a role on it. So a lot of times people have like the same kind of like structure, and they're like, well, it's genetics. Part of it is genetics for sure, but a lot of it is you're probably eating the same thing, probably behaving the same way in terms of like working out movement. So it's going to have the same result. Everything can be broken down into a system like A plus B equals C. Same thing with being stuck in that sympathetic state where you're surrounded by stress constantly, and your mom is always stressed out over tiny little things. It could be a learned behavior. Could also be you have that predisposition towards it slightly. But a lot of times what I see with people when they're in that hypersympathetic state and they're anxious constantly, it's your nervous system not functioning at 100%, not being able to drop in that parasympathetic to be able to heal. If you address that, and a lot of times when I see people come in for lots of different things like chronic pain, migraines, fibromyalgia, but they'll also say, I'm also anxious. I also don't sleep well. Like, they're not small, different things that need to be addressed. They all fit together, and it makes sense when I see it all together. They'll come in like you did for migraines, but then they'll say, oh, my sleep has gotten so much better. Like, I'm not waking up in the middle of the night now, and I can fall asleep without having issues. And I feel like I'm less anxious. I can calm down quicker. And it's because it's all your nervous system. It's all related. And what happens a lot of times, especially in the brain, you have those top two bones again. You have these things called your SOT muscles, your suboccipital muscles that connect those top two bones to your skull. And right in that area, you have what's called mechanoreceptors. So those are, this is kind of geeking out, but those are what help coordinate what's called proprioception. So proprioception is like how you know where your elbow is in space without looking at it. Proprioception to the brain. So mechanoreceptors, 80% of your body's entire mechanoreceptors. So a large chunk, majority of them are right here. So causing a change, a shift in this area with an adjustment can cause massive synaptic changes in the brain, which can cause help with issues that are deemed like brain balance disorders, which anxiety is one of those, depression is one of those.
Yeah, well, that makes a lot of sense. And it's I think the traditional approach with most medicine is to, like you were kind of saying, compartmentalize. Oh, you have anxiety. Let's give you a medication for anxiety. You're dealing with this. You have insomnia. You have depression, whatever it is. And they kind of continually check the boxes. And I think that was probably one of the best things after talking to you was I felt like there was this mental barrier that was broke, and I felt like I started to understand that emotional, spiritual, physical health, it's all connected.
They're connected. Yeah. Right.
We're just, you grow up in that environment and hearing that all the time from your doctors who are people you trust. And I'm not saying they're bad. It's just a different style and different approach. But you get so used to hearing that when there isn't one medication that fixes everything to do with your specific ailment, whatever it is, mine was migraines, you get really discouraged. And then they give you another medication for that.
and they all have side effects because everything's interconnected in your body. You can't just target one thing, right?
Yeah. And that actually brings me to my next question. What is your honest opinion about a lot of the medications that migraine patients are prescribed? Do any of them actually help, or what's your opinion about them, honestly?
I think just like everything, it depends on the person. So I have had some patients that, like you said, there's a myriad, there's so many different types that like they respond really well to triptans. And then I have other patients that absolutely cannot, their body repulsive, cannot handle anything, any sumatriptan, any kind of triptan. And then I have other patients who are like Excedrin knocks it out right away if I take Excedrin, and others who are like, doesn't touch it, nothing. Again, it's every single person responds differently. And you have to take that into account. Obviously, that's not my line of expertise, medication in general. But my thought process is always, let's try to be as healthy as possible. What does that look like? Let's try to be as holistic as possible. What does that look like in terms of integrating things? And let's try to not have to be reliant on a lot of things. Like, we should be able to be self-sufficient. Let's figure out the root problem, not just cover up the symptom whenever we need with taking something. You shouldn't have to take something for your body to function at 100%, because it's not like you're deficient of Advil and that's why you're in pain.
Yeah, that's a good point. Before I started seeing you, the last medication that was really pushed on me was Aimovig. I know that's a big one, and I don't know if it's officially out there just yet, but when it was being prescribed to me, it was an injection that you did once a month. And honestly, it helped a little bit, but then it would go away. And so I don't know how familiar you are with that particular medication, but I know that a lot of people who deal with migraines, they're getting prescribed that right now. What do you know about it? Is it really helpful, or why doesn't it last for, longer than a month?
Yeah, that's a great question. I do not know the biomechanics of that, specifically what it's trying to either block or inhibit or excite within the brain, or what chemicals it's trying to change. I actually don't know much about it, besides, you're right, it's an injection once a month, and it's a really painful injection.
Yeah.
Yeah. Yeah.
It was painful.
Yeah. But again, it's not that your body's deficient in that. You shouldn't have to take that. There's something else that should be addressed. And to their credit, they're taught this is how you heal things. You're either taking medication or surgery, taking something out, putting something in or taking something out. But I think there's a lot more like functional neurology that's developing, a lot more preventative medicines that are looking at your lifestyle and changing nutrition and vitamins, things that are trying to be a little bit more holistic, and versus like tertiary need to take this to like an abortive, to try to stop something immediately.
Yeah.
Like, at that level, let's try to address other things before it gets to that level. But I myself don't know a lot about the medication specifically, besides I've had a lot of patients that were on it before starting care. And then were able to wean themselves off. I don't ever tell them you should stop, or I always say you should talk to your doctor about how your migraine level has been and see if they think that you should wean yourself off or if you should continue the process. But I always think natural is better.
Yeah. As I've gotten older, I completely agree with that. I've become a lot more conscious and mindful about what really is being put in my body. And I think the biggest thing too that we don't really teach people is to be their own advocate in regards to their medical care. I wasn't really until about 25 that I started doing my own research and asking questions and started to realize there's so much about migraines we really don't know. So, that would be my number one thing of recommendation to people going through migraines, is to be your own advocate and to not be scared to ask for proper care and help. Because had I not done that, I would have never found you. And I even got involved in the political side of trying to get help for, trying to do more research about just pain, what we know about pain and chronic pain and migraines, and again, felt very defeated for a majority of it. But just don't give up. That would be my biggest thing, because I would have never found you. I would have never actually started to live my life again and have the migraines go away. But nonetheless, I digress. I also wanted to ask you what your opinion was about the current state of our medical care system in America. And I know that's a loaded question. So you can, attack it any way that you want. But it's just because, especially after 2020, I feel like there's a lot maybe that's a whole nother episode. But yeah. I'll just get your initial reaction on that question.
Yeah, I think to go in depth, we'd have a whole complete another episode, not just this little bit, but I agree. I think what you were saying earlier, to be your own health advocate is the most important thing. That's what I strive to do, empower people to own their health. You don't have to know everything that's going on. You don't have to know completely the biomechanics behind it. Like, I take my car to a mechanic because I don't know anything about cars. But I think it's important to ask the questions, like, what's really going on? What do you think is necessary? Like, do you think that this is something you would do this for your own car? You would do this for your own body? Like, just being a little bit more of a critical thinker with the questions you're asking, and being more empowered to ask questions, not just say, you're the doctor, you're the authority, I'll do whatever you say. I think it's important that you understand the why behind it and are able to make your informed decision yourself, yes or no for that. But in terms of the medical profession, I'd say there's a lot that with every profession, every system, there's always things that could be corrected, that could be more efficient, that could be better. But I have seen a trend, like I said, to a more preventative measure, more like functional neurology form of care. And I've seen a lot of people, again, maybe it's because we're in Southern California, that are open to and are willing to do more of a, let's stay as healthy as possible for as long as possible, like maintain, versus, again, with that car analogy, waiting until your oil is completely out and you're on the side of the road before going to get an oil change, And it's not just the yearly physical with your doctor. It's maybe like blood work to make sure everything's optimally running as much as possible. Getting your nervous system checked to make sure it's functioning at 100%, so you don't have these things that come out of nowhere because you never actually checked it on the function. So as long as you're measuring function, and I think it'd be great if more people were aware that these are the systems in your body that really need to be functioning well. Mm-hmm. When you're working on them and they are, then you're working at 100% and you can live an optimal life and you can thrive, not just like manage the pain, feel pain, that kind of thing.
Yeah. Thank you so much for answering that. And I only have a few more questions. I know that you're busy, but I did want to ask, how has the COVID-19 pandemic and the shutdown, all of 2020, how did that really impact you personally and professionally? Because I really think that for history, the everyday realities, that's something of 2020, I think that's at risk of being left out of the history books. So I try to take that opportunity every chance I get to ask anyone, how did that really impact your life?
That's a great question. Definitely impacted. I'm grateful. I'm blessed that I'm a healthcare provider. So I was allowed to be open, still an essential worker. I was able to stay open. I just had to elongate my hours because I was only having one person in at a time, cleaning in between every person. A lot less interpatient connection, relationship, contact whatsoever. So it was just, now these are my hours. They're a lot longer. And I obviously did have some patients who were uncomfortable coming in. I have a lot of patients who are older and who have like a predisposition, secondary issues that they're not comfortable coming in. So I had some people drop for a while and most of them have restarted again since then. But I think it was also a positive in that people realized how important their health was and they were willing to take time and make it work. Plus they weren't going to work. So they were working from home. They had more time to like come in for themselves. So I did have a lot more people trying to come in who previously hadn't been. Mm-hmm. That wasn't on their list of things to do, but now they're like, oh, maybe my health is important. I should address this. So there was that. And I think personally, I saw a lot of people go, you're going one or two ways when you're faced with a big challenge in life. And your choice, it's a decision of how you want to do. Do you want to be intentional and do something that will help you become better? Or do you fade into that fear and kind of just drop into a little bit more of a victim mindset and spin tail to the negative side. So I saw some people that, no one in my circle, but you heard obviously stories of higher levels of alcohol usage, higher levels of suicide, higher levels of children abuse, which is just unacceptable. But then you also saw so many people like working on themselves and working through not just like their physical workout health self, but also realizing, oh, my emotional component's a really big important factor. Like maybe I should work on my emotional acuity, maybe I should work on my mental abilities and like learn things, not just like consume Netflix all the time. Like maybe I should become a better person, try to be a better person. So
yeah. No, that's amazing. Thank you. And you hit on so many amazing points. A lot of things that I think it's important we remember about that moment in our history, because those are the things that kind of seem to, get lost in recording 5-10 years later. So I really appreciate that. And lastly, how do people get in contact with you, especially those who want to receive care? I don't know if you want me to say exactly how I found you, but
yeah, you can if you want.
I remember you mentioned it earlier and I didn't know if you liked that, but I found you on TikTok.
Yeah, totally fine.
So I love your account. I thought, and it was helpful. It was educational. And that was how I went in and found you. And it was great. But how else can people find you, especially to receive care? Because you mentioned earlier, I think it was only 1,200 in the world.
Yeah, there's only 1,200 in the world who do this technique. There's not a lot of us.
How do they find you?
You can go online. My company, so that I'm actually with a group of like 12 other doctors around the nation. And so we're all called The Specific, and you can go thespecific.com and find us there. Mine is the San Diego location, so sandiego.thespecific.com. And we're also on all social medias. I will be honest, I am not a huge fan of social media myself. I don't like spending time on it. So I've had help, which is why I had a TikTok. Awesome. I have someone who manages it for me. Because it's so important that people just become aware. Like you said, it's an awareness factor. People don't know that there's an option and they have that ability out there. So I don't really care if it looks funny or if I have to be goofy. Like as long as people now know, oh, this is an option and I don't have to take this for the rest of my life, or I don't have to undergo this crazy surgery for this. Like there's maybe another way that's less invasive of helping me heal. Maybe I should try that first. Because frequently people find me when they've tried everything else. And I'm like, last ditch hope, nothing works. I don't think you'll work either, but like I have no other options. Usually that's where people are at when they see me. But I'd love for it to be more well known and people realize, oh, this is also a really great option, maybe one of the better options for helping with these things. Let's try that first.
Yeah. Well, hopefully by, doing these interviews and your social media, more people will get to find you in the earlier stages and not get to that point where they feel like they've tried everything or they feel hopeless. And admittedly, that was where I was at when I started seeing you. So I hope too that someone can find you earlier in the process, or others within your profession that are closer to them, or, I hope they get that care earlier and that they are their own advocate, because I think that's a huge thing and a good takeaway, like you mentioned, from 2020 and the COVID-19 pandemic. So thank you so much, though, for taking the time to speak with me and tell everyone a little bit more about this, so that way we can make sure this perspective is preserved in the history books.
Thanks for having me on. I am so grateful. I always love sharing about this. I could never be sick of talking about it because I think it's just, it's such a, like you said, not well known, but really incredible opportunity and option for people to have a less invasive way of healing themselves. And that's why I do it. I want people to not just be stuck in this feeling of like surviving. I want people to thrive. And I love the idea of it being a ripple effect, because when someone's feeling well, then they're able to provide more for their families or be better persons, show up in their friendships, in their relationships. And it makes everybody's contact with each other more beautiful, I think.
I agree. Thank you so much. I truly appreciate you taking the time to speak with me, and I hope the rest of your day goes well.
Thank you. You too, Sarah.